Hello people, welcome back to my channel. In this video I will discuss about the drug therapy of these diseases. How you should write the prescription for these diseases. Generally this is the most important topic comes in pharmacology viva. They will ask the one of these diseases and ask to prescribe drug therapy for these diseases. So I will discuss some of the diseases in this video. In next video I will discuss the another 5 diseases of how you should write the prescription about those diseases. So in this video I will discuss about the first the patient came. First example in pulmonary TB, like pulmonary TB, leprosy, typhoid fever, malaria, urinary tract infections. I will discuss these 5 in this video. If any patient come with any of these diseases or any other diseases, first you should write the first here doctor's name, and where the doctors like Nalgunda or anything, you should write the doctor's place, like state. Next you should write the date is very important. Next in this side you should write the patient name, age, sex and address. What is the occupation of patients also, so you should write. Next you should write the treatment. So we should discuss the all this treatment. In all this you should write like this only. This right side you should write the doctor's name and place and date, and in this you should write the patient name, age, sex and address. Okay, next we should discuss about the reactions of all. Reactions means treatment of all these diseases. Okay, so now we should discuss about the pulmonary tuberculosis treatment. First of all, in pulmonary tuberculosis treatment for 2 months and for 4 months. 4 months and 2 months is present. Okay, 4 months and 2 months. So what are the drugs can be given in pulmonary TB? You already know this what is that, mnemonic HRZE. You know this mnemonic HRZE. For 2 months we should give an isoniazid. H means isoniazid. R means rifampin. Z means pyrazinamide. E means ethambutol. In this we also give pyridoxine. For pyridoxine is generally given for to decrease the side effect. When we give an isoniazid, there should be some side effects like peripheral neuritis. So to decrease this, pyridoxine should be given. These are like isoniazid, like 300 mg, rifampin like 600 mg, pyrazinamide for 150 mg, and ethambutol is 800 mg. Pyridoxine is 10 mg only. These all are given for OD. Only one time a day, once daily once should be given all these drugs for 2 months. Isoniazid, rifampin, pyrazinamide, ethambutol and pyridoxine for 2 months. For 4 months same, HR means isoniazid like 300 mg OD. Next rifampin, what is that, 600 mg OD only. Next, to decrease peripheral neuritis is a side effect in isoniazid, so pyridoxine, same pyridoxine 10 mg OD. This should be given for the treatment of pulmonary TB. What is the treatment of pulmonary TB? Isoniazid, rifampin, pyrazinamide, ethambutol, pyridoxine for 2 months and for 4 months. Okay. Next we should discuss about the leprosy. I discussed about the pulmonary tuberculosis. Next we should discuss the leprosy, that lepromatous leprosy. What is the treatment for lepromatous leprosy? Lepromatous leprosy. Same, doctor's name and place and date should be written, and same patient name, age, sex, occupation, address should be written here. Next, what is the treatment? Treatment of lepromatous leprosy. There are 3 drugs to be used in lepromatous leprosy. What are the 3 drugs to be used in lepromatous leprosy? Clofazimine, rifampin, and dapsone. These are the three drugs. So first we should discuss about this. In this lepromatous leprosy, supervised and unsupervised drugs should be given, like supervised in presence of supervised persons, and unsupervised also should be given. First supervised drugs are rifampin and clofazimine. This is rifampin. It is how much mg? 600 mg. Rifampin 600 mg should be given. In supervised, the 2 rifampin, clofazimine also given. These 2 are given once a month. 600 mg take once a month for 12 months. For 12 months, once a month, under supervised for 12 months should be taken this rifampin 600 mg. Next, clofazimine 300 mg same, take once a month. For month, 1 tablet up to 12 months. Under supervised 1 month for 1 tablet is rifampin and clofazimine, and unsupervised is dapsone and clofazimine. See, these are the tablets. Tab dapsone. It is 100 mg. It is also take once daily for 12 months. Daily one tablet should be taken for 12 months. Tab dapsone. Next, tab clofazimine like 50 mg should be taken. Here 300 mg, here 50 mg for OD, means once daily for 12 months. This is the treatment for lepromatous leprosy. What is the treatment of lepromatous leprosy? Rifampin 600 mg, rifampin, clofazimine 600 mg, 300 mg once a month for 12 months. Here daily for 12 months, dapsone and clofazimine. Dapsone is 100 mg, clofazimine is 50 mg, half 50 mg. Okay, this is the lepromatous leprosy treatment. This is the TB treatment, and this is the lepromatous leprosy treatment. Next, we should discuss about the typhoid fever. Typhoid fever is most common. So next, typhoid fever. For typhoid fever, same prescription, right? Doctor's name and place, next date, and patient name, age, sex, occupation, next address should be written. Next, we should write the treatment of typhoid fever. For typhoid, we can use the ciprofloxacin and paracetamol capsule. Ciprofloxacin is capsule. Ciprofloxacin, not flaxin. Ciprofloxacin. A minute. Ciprofloxacin. And tablet paracetamol. Ciprofloxacin and paracetamol. Ciprofloxacin, how much mg? 500 mg. Paracetamol also 500 mg. In typhoid fever, this tablet should be prescribed for 10 days. Ciprofloxacin, which is for BD, 2 times a day for 10 days. Here, paracetamol is thrice a day for 10 days. Typhoid fever, the tablet should be typhoid fever for tablet should be prescribed for 10 days. Tablet should be prescribed for 10 days. Ciprofloxacin for BD and paracetamol for TDS. Next one is malaria. What is the same? First, you should write the doctor's name, place, and date, same as patient name, age, sex, occupation, and address. What is the treatment? Treatment for malaria. For malaria, we should use for Plasmodium vivax, mainly we can use the chloroquine. So tablet chloroquine, which is 250 mg. These are 10 tablets. 10 tablets should be given. 10 tablets. First 4, 2, 2 and 2. This comes 4 immediately. The patient immediately should be given to the patient. Next 2 tablets for first day, and second and third day should be other 2 tablets. These are the tablets of chloroquine. 250 mg should be given to the patient, divided into 10 tablets. First 4 should be given immediately after knowing that at first day should be given 2 tablets, and second and third day should be given for 2 other tablets of chloroquine. Next we should use same paracetamol tablet. Paracetamol same 500 mg, like above 500 mg for 5 days. In typhoid fever, we should use the 10 days paracetamol and ciprofloxacin. In malaria, for 5 days should be required paracetamol. Here chloroquine 250 mg, 10 tablets are divided into 4, 2, 2, 2. 4 immediately, 2 should be given first day, and 2 should be given at second and third day. This is the treatment of malaria. Next we should discuss the treatment of urinary tract infections, UTIs. For urinary tract infections, same for UTI, same doctor's name and place and date should be right. And next patient name, age, next sex, and next occupation, address should be written. Next we should write the treatment of if a urinary tract infection should be given the tablets for 5 days, but in typhoid we should use the tablets for 10 days. Should remember that 10 days. So urinary tract infections for 5 days only. For 5 days, what are the two? Generally 2 tablets should be given, like nitrofurantoin and norfloxacin. Here norfloxacin is capsule, norfloxacin, which is 400 mg. We use it for 2 times a day, like BD for 5 days. Next tablet is nitrofurantoin. Nitrofurantoin, which is here 400 mg. Nitrofurantoin only 50 mg for TDS, thrice a day for 5 days. So if the patient come with UTI infection, the tablet should be given for 5 days. Mainly main tablets for urinary tract infections are norfloxacin and nitrofurantoin. Norfloxacin, if the norfloxacin is given, generally it should be given for 2 times a day, like BD. Nitrofurantoin for thrice a day. Whereas malaria has 2 tablets, like chloroquine, paracetamol. Same typhoid fever for 10 days, like 2 tablets, like ciprofloxacin is also capsule. This is also for 2 times a day. Paracetamol for thrice a day. Next lepromatous leprosy as under supervised and non-supervised tablets should be used, like rifampin and clofazimine, which comes under 600 mg, which comes under 300 mg. Take once in a month. Like it used for 12 months. Next unsupervised is tab dapsone 100 mg OD for 12 months, and tab clofazimine 50 mg OD, means only 1 time a day for 12 months. Dapsone and clofazimine 100 mg 50 mg. Next pulmonary TB also for 2 months and 4 months, and isoniazid, HRZ, pyridoxine also used, like 300. These are all used for only one tablet for day, once daily, like that 300 mg, 600 mg, 150 mg, 800 mg and 10 mg. For 4 months only HR pyridoxine only should be used. This is the some of the drug therapies should be asked in pharmacology viva. In next video I will discuss about another 5 drug therapy prescription writing. Mainly they will ask in pharmacology viva. Thank you. Please subscribe my channel and please support us. Thank you.